Okay, I think we're gonna get started. I know a few people are still joining, but welcome everyone to HCP's online webinar for this month. We have a great speaker, Nicole Stately, who will be giving our presentation today. And before we start, I'm going to briefly introduce her and read her bio. Nicole Stately has spent the last 19 years in the healthcare management industry. She has been involved in a little bit of everything, including clearinghouse management, medical billing, coding, auditing, and compliance. She currently has certified professional certificates in compliance, medical auditing, and coding. She's passionate about helping organizations to not only be compliant, but to feel supported in their compliance efforts. With that, I will turn the time over to you, Nicole, and we can get started.
All right, thank you, Josie. I also want to say that we will be doing a Q&A hopefully at the end if I don't go too long-winded on some of these topics. So feel free to use the Q&A to drop any questions in there. I have Jake on the webinar with me today, so we'll tag team that Q&A if we get a lot of questions. But feel free to put any questions you have in there. If we don't have an answer today, we'll certainly reach out to provide that answer for you. So welcome. I assume if you're on this webinar, then you're either part of a small practice or small organization. If not, let's say you're like, oops, I signed up for this and I'm not part of a small practice. This information will still be relevant to you. It is just a little bit more in the context of working, with a smaller team, probably smaller budget, those types of things. No fear if you feel like it doesn't quite fit. All right. Healthcare compliance for a small practice. What can you not ignore in 2026? Today, we're going to be going over the OIG's expectations for what a compliance program looks like, even for a small practice. We will be talking about the top risk areas that the OIG has identified, the top challenges that small practices normally face, and then I'll give you a compliance roadmap. So, kind of where to start. So even if you've already kind of started on a compliance program, it'll at least kind of show you here's some good metrics for, where you should be at, a little bit of a timeline. So we'll go over something to kind of at least just get you started or kind of give you a good indication of where you're at on getting that program going. All right. So compliance program, is it required? Is it not required? We actually get this question quite a bit. There is a lot of misconceptions around whether or not an actual compliance program is a requirement. So technically, under the OIG, which if you don't know who the OIG is, that's the Office of Inspector General, part of the governing body that helps with investigations, that helps with enforcing HIPAA, with the OCR. That's HHS and OIG are work hand in hand together. So they are one of the main authorities on whether or not you need to have this. So to be clear, it is not necessarily a requirement. It is considered voluntary. And the OIG even puts this in their program guidance, which we'll be talking about today, that this is voluntary recommendations. However, it is 100% expected. It always cracks me up when I answer this question when people ask, because I'm like, you're right. It doesn't say required, that you're required to have a compliance program anywhere in the OIG's guidance. But if you were to be audited or you have some sort of HIPAA breach and there's an investigation, the questions that those auditors and investigators are going to be asking you are directly related to your compliance program, and it is expected for you to have those things in place. So again, we can't say it's required because it's not, but it is expected. It can be used against you in investigations and enforcement actions if you don't have these things in place. And the size of your practice, the size of your organization is not taken into consideration. So again, the OIG, they say voluntary, but again, it's expected. CMS. Now there's can be a little bit tighter restrictions there, right? If you work with Medicare Part D, if you work with Medicaid managed care plans, it is very likely that part of your provider contract states that you will have a compliance program in place. So that's where sometimes that requirement piece can kind of sneak in there, right? Depending on who you're contracted with. federal programs you're working with, it might be in your contract that you state, I will have a compliance program. So that's something to definitely watch for and be careful that you know exactly what those expectations are. Now, commercial payers, this can be a little bit of the wild, wild west, right? Um, Most commercial payers are not going to come out and say compliance program, right? They're not going to say you need to have these elements like the OIG states. But a lot of what you'll find in your provider contracts is more or less components of a compliance program. They just don't call it that. So again, the expectation is there that you're going to be watching for fraud, waste, and abuse, even at the commercial payer level, right? You might not be dealing with federal dollars, um, but you're dealing with payer money, right? And they want to make sure that you are not submitting claims that don't meet medical necessity and all that fun stuff. So they definitely have stipulations in their contract that are indirect correlation to having a effective compliance program. If you have an effective compliance program in place, most likely you're going to be meeting those requirements that are outlined in your contracts. So again, it is strongly encouraged. It is 100% considered best practice to have a formal compliance program. Now, as a small practice, it might look a little bit different. And so that's kind of what we're going to talk about is how you can meet those standards, you can meet those expectations given some of the challenges that smaller organizations face. So first thing, we're going to do a poll. So Josie, if you want to get our first poll launched here. But the question we're asking is, again, in the compliance context, which area worries you the most right now? Does your billing and coding compliance concern you the most? HIPAA privacy? Is it HIPAA security and cybersecurity? Is it maybe some training gaps, or maybe you guys aren't doing any training at all when it comes to compliance or HIPAA? Or is it other? Maybe you have something else that is concerning to you. So go ahead and let's see. I guess I have to pick one here, maybe. Um, let's see. I'm not sure. Hopefully, you guys can see that poll on your end. See, I'm not seeing it pop up here.
Oh, it's
Josie,
getting
can,
yeah, it's getting responded to.
oh, is it? Okay.
Yeah.
Okay. I'm not seeing it on the screen. So if you just kind of want to give us a, what does it?
Yeah, I'll
Um,
end the poll in just a second
okay.
and
Okay. Perfect.
then we can see it. Yeah.
Oh, okay, awesome. I was like, I'm not seeing it. Am I going crazy? So yeah, go ahead and make your selections.
Do you see those
All right.
results?
Okay, perfect. Okay, so what I'm seeing here is 39% say HIPAA security, cyber security, and then second in line is billing and coding. I would say that is in line with the clients that we work with, what we see the most. HIPAA security, cyber security is on the forefront of everyone's mind. So that makes a whole lot of sense there. So great. Thank you everyone for participating in that. Um, so thinking of those risk areas, obviously we're going to take a deeper dive into those as we go along and hopefully help address some of your concerns and help give you some good tools to maybe lessen your worries about some of those areas. So where we're going to start with is the OIG 7 elements of an effective compliance program. This can feel very overwhelming. I know when I worked for an RCM company before I worked for Healthcare Compliance Pros, and I was tasked with creating a compliance program from scratch. I uh, was just starting out in compliance. I knew very little. I knew about HIPAA, obviously, but when I looked at these 7 elements, I thought, oh my gosh, like how am I going to do this? This is so much. Um, the OIG provides us with an outline, right? They say these are the things that if you have these in place, this will help you create an effective compliance program. Now, this isn't a checklist where you're like, oh, check, check, check. I have all these. That doesn't necessarily mean it's effective, right? So I'm going to go over the 7 elements just real quick here, and then we're going to dive into what the OIG kind of points out as what's most important for small entities to think about and ways that you can look at these 7 elements on a smaller scale, not necessarily minimizing the importance, um, But sometimes the language when you're looking at these seven elements feels very, I don't know, corporate maybe is the right word, where they're like, oh, you need to have a governing board and a compliance committee. And you're thinking, oh my gosh, we're an office of five people. How are we going to do that? So again, the seven elements, I don't know if you've ever seen these before, but this is their standard elements. Policies and procedures is number one. That is the foundation, right? Compliance leadership, training and education, proper communication and reporting. So that's communication between your staff and whoever's kind of in charge of compliance. And then who's going to be in charge of reporting if there is some sort of HIPAA breach. Having consequences and incentives based around compliance, right? So if you have compliance issues, making sure that you have the proper consequences and sometimes incentives. And that doesn't always need to be dollar incentives, which we'll talk about. Making sure you have some auditing and monitoring that is taking place. And then the last element is response and corrective action. So when you do have a HIPAA incident, when you do have a HIPAA breach, or you have someone that just isn't following, payer guidelines and they're, putting a modifier on things they shouldn't be putting a modifier on, what's your response to that and what are the corrective actions? So to the OIG and most industries, point always to these seven elements when they're talking about a compliance program. All of these elements help you create that program. And so now the key is, okay, how do we make that effective given our smaller structure? First main thing here is you need to establish a compliance contact. Okay, this person, and probably if you're on this call, it might be you, and you might be thinking, oh my gosh, I wear already 10 different hats within my practice, within my organization. Now you're saying I have to be the compliance officer and champion this program. And I'm kind of saying that, but I'm also kind of not saying that. It does not need to be a full-time job. You need to just make sure that at least at the very base, you have a compliance contact. You need someone within the organization that staff know, okay, if I have a compliance concern, I know I can go to this person. I know I can email this person. I know that this person will help me figure out, what to do. Ideally, this person should not be like an attorney. So if you have, say, an attorney your practice works with, don't ask them to be your compliance contact. You want someone really within your organization that is kind of outside of that legal presence. Now it's nice to have an attorney when you do need legal help, but a lot of times your compliance stuff is not always where you need like a lawyer. Sometimes it really is just staff making sure that they're following HIPAA properly. It's a lot more simple things every day, not always large legal type things. You ideally, and this is where it gets tricky in a small practice, but you ideally want someone that's not involved in claims processing. So you don't want someone who's, your billing lead, your coding lead. Part of that is because all of that is tied to revenue, right? That's how your practice makes money, is on how claims are billed, the follow-up of those claims, the coding of those claims. And that creates somewhat of, possibly a conflict of interest, right? So let's say you do have a billing practice within your organization that isn't quite correct. And let's say your compliance contact is in charge of billing and coding, and then you have, a subordinate or another person on the team who raises concerns over that billing and coding practice. And sometimes that compliance contact is not going to listen or understand the issue because they're the ones in charge of it, right? So ideally, you want someone that is not directly involved in billing and coding. The last piece of that compliance contact is you want them to be able to report to someone. So ideally, the owner or CEO of your practice should not be the compliance contact. Now, sometimes you might say, okay, I am the owner of my practice and I have one staff person. And so, unless I have that staff person be the compliance contact, then, that doesn't really make sense. Okay, in that case, you might be the owner, CEO, and compliance contact of your small business, right? And that's obviously understood by the OIG that you can't create extra positions just so that the owner and CEO is not also the compliance contact. But if at all possible, have it be someone else. That sometimes is a great role for the office manager. And I know office managers on the call, you might be thinking, oh, please, God, no, do not give me another task, right? But a lot of times that is the right person to have as the compliance contact because you really see all, right? You're seeing all the operations. You know what the policies and procedures are. You know what your staff is being asked to do. And so sometimes that just makes the most sense. All right, next up here is policies, procedures, and training. So training, it's not optional, right? Under HIPAA, if you are involved with PHI at all, which I assume everyone on this call is, you need to have training on HIPAA privacy and security. You need to have training on breaches and how to report breaches. That is absolutely necessary. You want to make sure that your staff understand how to perform duties and how to perform them compliantly. You want to make sure they understand the federal guidelines. You want to make sure they understand payer guidelines, if you need to have training on that. And you want to make sure your training is in line with your program, with your practice. Your training should be, role based if possible. You might be saying like, oh my gosh, like, okay, we kind of have training, but it's, an old PowerPoint presentation. It's not very fun. That's okay. That might be all you have to work with right now, and that's all right. The main point is that your staff are being trained. Now, does that training maybe need to be updated and maybe need to be more interactive or scenario based? Probably, but at least start somewhere. Don't throw it totally out because it feels um outdated. Now, if the regulations are outdated, then 100% you should change those. But if just the feel of it, isn't super exciting, that's okay. Make sure you have some type of training that your staff is getting on compliance matters. Again, main focus there on HIPAA privacy, HIPAA security, and breach notification rules, partly because that is a requirement under HIPAA. So that's partly why the OIG, puts that as part of their effective compliance program, because in order to comply with HIPAA, you need to be having that training. Policies. This is always a struggle, even with clients that we interact with. A lot of times clients come to us and they say like, okay, I already have policies. And we're like, okay, cool. Let's take a look at them and just see what you have. And I would say 9 times out of 10, our clients come to us thinking they have all the policies that they need, but what they actually have is a lot of HR policies, which are good, right? They have some corporate compliance policies. So stating that people will comply with all of the laws and regulations, that people will follow your code of conduct, they won't have any conflicts of interest. But what we see a huge gap in is HIPAA policies. So specific HIPAA policies having to do with HIPAA privacy, HIPAA security, and those breach notification rules. That is the biggest gap that we see. Now, for small organizations, again, that can feel like a daunting task. But use your resources, think outside of the box a little bit. If you use a management company, if you use an HR company, they might have some templates already available for you that you can use. Now, the caution I will say with templates is it still needs to fit your practice, right? So don't just take the template and approve it and be like, oh, yeah, this is good to go without reading it, right? You need to look at it and say, okay, does this actually fit our practice? Another option is, hiring a consultant to help you get those policies in place. Again, that you might have some budget constraints there, but that is an option. You can use the internet to help you find policies. Now, another disclaimer with that is obviously sometimes that actually is more work because you need to make sure that the sources that person used are correct, that this isn't like a Wikipedia policy that was created. And I know the popular thing right now is AI policy creation, which we are definitely not necessarily opposed to here at HCP. But again, with that proper, magnifying glass on, okay, where did this AI agent get this information from? Did they just pull it from somebody's blog or from, so and so who says they're a compliance consultant, or is it actually grounded in, say, like the HIPAA security rule? So again, don't necessarily be afraid to use the internet, afraid to use AI, but just make sure that you're being careful with that. OIG training video. So if you say, oh my gosh, we have no training, We do not have the budget for training. What are we supposed to do? OIG does have some training videos on their website. Now, I've looked at those. They are not great. Like they just aren't when I talk about not being entertaining. I'm not exactly sure what year they were done. I'm guessing somewhere in the 90s, probably, just based off of how everybody's dressed. But again, it at least is something, right? Something exists out there that if you're really in a panic, where you realize we have a huge training gap, look for some of those free resources that are out there. Next thing is get creative. You know, nowhere does it say that your training has to be in a PowerPoint, or nowhere does it say your training has to be in a certain format, right? The thing with training that is best practice is the content, making sure that it's relevant to your staff, that it actually teaches them how to interact with HIPAA, how to interact with PHI in their jobs, and to do it correctly. So guess what? You can use team meetings. You know, you can get creative with that and do fun things. You can even email reminders like, for example, hey, don't forget to, use strong passwords so that people can't easily hack into our systems. You can, have fun with it. You can do physical postings. You can post reminders, in a common area in the office about different training topics. Again, um, don't feel like your training has to be a certain way. The more important thing is the content and making sure that your staff understand it, making sure that it actually helps them to do their job more compliantly. Obviously, from HCP, we would love it if you got on board with us and you used our training. But again, like we understand that small practices have limited resources. And so if none of working with a consultant like us is not an option, then you're going to have to just get a little bit creative, but it is possible. Next up, that the OIG recognizes for small practices that is a super important element is that open lines of communication, open door policy. Now, this sometimes gets a little bit tricky, again, in a small office, small organization, is everyone knows each other, right? And so sometimes people feel uncomfortable where they don't want to report, compliance issues or a possible HIPAA breach because they don't want to rock an already small boat. But you want to make sure that, again, that compliance contact is somebody that everybody knows, hey, this is a safe person to go to with your concerns, and that they understand that there is an open door policy. Along with that is that good faith reporting. You should require that. That should be part, ideally, of your staff's job descriptions, is that if they see something, if they recognize a possible compliance risk or a HIPAA breach, that they need to report that. That is not something that it shouldn't be allowed to, keep things a secret because you're afraid. Another piece of that is non-retaliation, right? If someone comes to your compliance contact, if someone comes to you and reports something, they should not be afraid that they're going to get in trouble for it. Again, in a small organization, this gets a little bit tricky because a lot of times you know the people you work with really well. You might even be friends with the people that you work with. And you don't want to be seen as the tattletale that is going and saying, like, hey, Susie did this such and such with PHI yesterday. But here's the deal. Those small, sometimes awkward, uncomfortable conversations are hopefully going to save you from a larger HIPAA breach someday that could tank your practice, right? In reality, we've seen a lot of small practices close due to HIPAA breaches, and a lot of those breaches are due to human error. So you want your staff to be comfortable talking about those things. And a lot of times it's not intentional, right? Your staff are not making compliance mistakes intentionally. So sometimes that shows that there are some gaps, other training gaps, policies and procedures, which we'll talk about when we talk about auditing and monitoring. But again, make sure that people understand that good faith reporting is 100% encouraged. Along with that, that reporting transparency, you want staff to understand, hey, when you report something, like here's what we'll do with that report, right? We're going to take it seriously, we're going to investigate it, and we're going to figure out, what's going on. If at all possible, you want to keep the person who reported the issue anonymous. Again, in a small space, that might not be possible, right? Everyone knows everyone. Everyone's going to probably figure out who it is that reported it. But what you don't want to do is when something was reported, you go to the person and say, hey, Susie told me yesterday that you did this, this, and this, right? You want to make sure you approach things as professionally as possible, not using that reporter's name, but keeping things general and really just trying to figure out what happened. Next up, we have risk assessment, auditing, and monitoring. So again, the OIG for small practices. So I forgot to mention this before I even jumped into all of these things, but within the OIG, they have their general compliance program guidance that was released in November of 2023. And starting on page, I want to say 65, is a whole little mini section that is geared towards small practices. So a lot of this piece of the presentation I took straight from that. This is what the OIG says, that even though you're a small practice, these are the things that we want to make sure that you're focused on. So definitely go check out that portion of that guidance. Again, I want to say it's on about page 65 that the small practice discussion starts, but it's really, really helpful. But one of the things, again, that they mention in there is risk assessment, auditing, and monitoring. Risk assessment. If you've been around HCP at all, we talk about the security risk analysis pretty much constantly because it's such an important piece. Do not sleep on that. Part of the reason is that is another thing in HIPAA that is a actual requirement. So the OIG recommends it, but HIPAA says, hey, if you're interacting with PHI, you need to complete a security risk analysis. Now, best practice is to do that at least once a year. There are free online tools. So if you say, oh my gosh, we've gone and looked at a vendor and they said they were going to charge us $10,000 to do a security risk analysis, there's no way we can do that. Side note, at HCP, we do not charge you that much. We are one of the cheapest security risk analyses out there, in my opinion. But even if you can't afford us, there is a free online resource on OCR's website. There is a free security risk analysis tool, and they give you everything. They give you your risk score. They give you recommendations on what you can do to mitigate that risk. It is a good tool if you have no other options. The plus side of obviously going with like a consultant like us is we will kind of hold your hand through it and really work with you on those recommendations and explaining to you how to actually, mitigate those risks. But all in all, doesn't matter how you do it, but make sure you do that risk assessment. That's the best way to identify potential risk, current risk, and then also helps you to prioritize those high risk areas and be like, ooh, okay, this is a super high risk area that we need to figure out, immediately. The next kind of piece of this is auditing. So sometimes when I say auditing, people instantly think of just billing and coding auditing, which is 100% a piece of this, but it's not the only piece. When I'm talking about compliance and a compliance program overall, you can really audit pretty much anything, right? You can audit your policies, you can audit your procedures, you can audit billing and coding. You can audit your access logs to see who has been accessing your EHR. There are lots of different auditing type activities. This says, OIG says at least once a year to perform kind of a full-blown audit. I think it should be done more often than that because I don't want to wait that long, right? I don't want to wait a whole year to see if we're making a huge mistake or if there's some misunderstanding about even billing and coding requirements. But in conjunction with the risk analysis that you do, that'll probably help you identify some areas that for sure should get audited. So sometimes, a lot of times, our clients have issues with this auditing piece because they're like, I don't even know what to audit. Billing and coding seems pretty straightforward. Most people understand how to audit that, but then outside of that, they're not really sure where to start. And so we always point them back to that risk assessment and say, hey, what other things were identified in that risk assessment as maybe a moderate or high risk? That's a great place to start with auditing to look into those things. From those audits, you might need to make procedure or policy changes. You might see that, okay, the reason that this is a high risk is not so much because we don't have a policy, it's because our policy doesn't actually fit our organization and it's unattainable. We have clients sometimes that come in with policies that are like 5 pages long for one thing. And it's like, well, no wonder, staff aren't following that policy. It's too long. They can't understand it. They don't know what they're supposed to do with it. So, those audits can help you figure out if things are actually working. Following up on the auditing is such a huge piece. You don't want to just do an audit and then put it aside and be like, check, our audit was done. You want to actually see, okay, what did we identify? What corrective actions need to come from that audit? Next piece is monitoring. This is a more frequent, ongoing task. This helps you manage your known risks. So you've done the risk assessment, you've done your audits, and you've said, okay, well, now we've changed this policy to, it's only a 2-page policy and it's super easy to understand. Well, now the monitoring piece comes in because you're like, all right, well, now we have to see, is this actually working? We've made this change, we've implemented this, but if it's not working, then it's still broken, right? So the monitoring is more that ongoing, watchful eye of, okay, like, is this how we expected this to function? Part of your monitoring activities can be exclusion monitoring, which we'll get into more. Access to PHI, provider licensing and credentialing, is part of those monitoring pieces. Next up, we have enforcing standards. So if you don't have standards, if you don't have a commitment to those standards, so let's say you have staff and it's kind of wild, wild west, you don't really have anything written down, you haven't asked your staff to commit to compliance, then it makes it really, really hard to uphold those compliance measures, right? So you want to start out with that commitment. You want to make sure that staff understand from day one, or let's say you're like, oh my gosh, we've had staff already for 10 years. That's okay. Maybe make a code of conduct. Once you get those policies and procedures and training in place, be like, all right, this is a revamp, right? We are now saying we are committed to compliance. We're committed to HIPAA compliance. We're committed to this compliance program, and we need buy-in from everyone, from the top, owner, CEO, however your structure is, all the way to the bottom. Because then once you have that commitment, you can actually enforce those standards. And you should. You should have consequences for non-compliance, even if it's human error, even if it's a mistake, right? Um, so I like to use, the example of like children, right? We can have standards and rules in our house, but if there's no consequences, how many of our kids are actually going to follow those standards if something's not going to happen if they don't follow it? Now, these can be obviously scaled to the quote unquote crime. Hopefully, it's not a crime yet. But let's say someone just human error makes a mistake. Let's say they email PHI without encrypting the email. And it was just kind of like a one time, like, oh my gosh, I'm so sorry, I forgot to do it. Maybe that's more a verbal written warning. Maybe it doesn't have to be a huge, full blown thing. You don't need to fire that person. But if you have someone that's a repeat offender and they keep having issues with compliance and they don't seem to show they're actually committed to it, then maybe that is, more a probation type thing or a termination of employment. And that feels harsh. But again, if you ever get investigated or audited, that can be harsh, right? Those fines can be very, very harsh. The OIG, OCR, they will not hesitate to hand you a consequence for noncompliance. And so you shouldn't really hesitate with your staff, even if you have a small staff, even if it makes things a little bit uncomfortable. But I guarantee you, when you have that commitment, that buy-in from everyone, and the understanding that it's a team project to maintain compliance, then people understand that when mistakes are made, that that has to be accounted for. On the flip side of that, I encourage you to incentivize compliance. Now, again, that might not always be a dollar amount, but find ways to make compliance fun. Now, I always joke that like Jake and I are compliance nerds. We love to chat compliance, and I know that not everybody does. So, probably most people in your organization, when they hear the word compliance, they might start rolling their eyes, right? But if you can figure out a way to make it fun, I had a project at the RCM company I worked for where our password situation was like completely out of control. People had passwords on Excel spreadsheets. People had the same password for every single thing they logged into, and we realized that that was a risk, right? So we ended up going with a password manager to help us keep everything organized. It was a HIPAA compliant password manager, and it was really cool because they gave you a score, not only based on whether or not you had a different password for everything. Also, if you had a complex password. So it would give you a basically health score of your passwords. And what I ended up doing was once we implemented it, that I said, hey, anyone who by the end of 30 days has, I think it was like a 90 to 100% health score would get entered into a drawing for like a $25 Amazon gift card. Not a huge expense, super easy. And it made it kind of fun, right? Because already people were annoyed that they were going to have to go and change all of their passwords and make them more complex. But that just helped kind of incentivize that, like, hey, like we understand that this is an extra step, that this is extra work, but like here's a little fun like drawing. And like it ended up being super successful and everyone got their passwords like in check, which was the most important piece. All right, next up we have response and corrective action. So this is the last element that we'll focus on as far as what the OIG recognizes for small practices, small businesses. It is probably to me, I mean, I guess it's so hard. All of those pieces are super, super important. But I do see a lot of scrutiny around this section, response and corrective action. So incidents and offenses, they're going to happen. If you think that HIPAA incidents are not happening in your office, I can almost guarantee you're wrong, right? There's a whole nother webinar we could do on the difference between a HIPAA incident and a HIPAA breach. But a HIPAA incident, a lot of times are near misses, right? Oh, that was almost a breach, but not quite. Those are probably happening possibly on a daily basis within your practice. Actual breaches, hopefully not too often. But even if they do, you want to make sure that you respond to them appropriately. What the OIG wants to see is they want to see that you're reacting to those things promptly, that you don't have someone report that, like, hey, I think I clicked on a phishing email. And then you say, oh, okay, yeah, I'll look into it. And then months go by and you realize, oh my gosh, our whole EHR, got compromised and all of our records were stolen, right? They want to see that you take any even just minor incidents seriously, so that you are investigating them and that you are figuring out, okay, what do we need to do to either make sure this doesn't happen again, or possibly, okay, this was a breach and now we need to go through the proper channels. We need to report it to HHS. Part of those corrective actions, besides maybe reporting to HHS, if it's more an internal thing, maybe it was just an incident, could be policy revisions. So this is one that we see super often because a lot of times your policies and procedures make it difficult for your staff to be in HIPAA compliance, right? You maybe don't have, let's say, encryption on your email, but you're allowing staff to email PHI and that's an issue, right? So maybe that would be a policy and procedure change where you say, okay, we don't have encryption, which means we have to find another way of sending PHI to, say, your medical billing company or to payers or different entities. Um, that could be a policy and procedure revision that needs to happen, which would be part of your corrective action. Another thing that we always recommend whenever we have a HIPAA incident reported to us, because we help our clients work through those and mitigate those, is one of the first things that we usually suggest is education. Receiving a quick refresher course on HIPAA privacy, HIPAA security, whatever the situation was. And again, doesn't have to be a fancy training. It could just be a quick team meeting reminding everyone to slow down, be careful, don't email PHI that's unencrypted, as far as for that example. And then a corrective action, again, could be consequences. I think that in a small practice, you don't always have to go extreme with the consequences, but you want to be consistent. You don't want to show favoritism. That can sometimes be tough because let's say you have an employee who's been there with you for 15 years and someone complains and says, hey, I think they're violating HIPAA. And you might be hesitant to give them a consequence because they've been with you for so long. But you want to make sure that if that consequence, if you would give it to an employee that's only been there for 6 months, then it should also be given to the one who's been there for 10, 15 years. And even more so, hopefully that staff that's been there longer understands that, sometimes they set the tone. They're the example to newer staff. All right, next polling question. Who currently owns compliance, owns with quotes, in your organization? So your options are me, myself, and I. We have a compliance team. the CEO, IT, I think, or nobody. So again, these are anonymous. Feel free to answer honestly. This is a compliance webinar after all, so we're all about honesty. But who currently owns that? I'll just give you a few seconds here. All right, Josie, if you feel like um, enough people have put in their thing. Oh, there it is. Okay. Ooh, almost. Oh, okay. Some of you have a compliance team. I love that. Okay, me, myself, and I about 41%. Compliance team 49%. Okay, nobody is only at 3%, so that's good. IT, okay, that's probably not the best option, right? CEO, again, like we talked about with a small practice, that just might be only option you have, right? Okay, but that pretty much makes sense. Those of you that have a compliance team, I love that. Um, Even in small practices, you might have a committee, you might have a team that's helping you with all these tasks, which is really nice if you can have that. All right, so now we're going to go over the top risk areas. So these are the top risk areas that the OIG has identified specifically for small practices. All right, so billing, coding, and documentation, HIPAA privacy, HIPAA security, that breach risk, exclusion screening, and then quality care and patient safety. So we're going to break down each of these real quick here, and then we will get to that roadmap. All right, first up is billing, coding, and documentation. So the OIG in that small practice guidance, they really highlight claim accuracy, documentation of medical necessity, and avoiding improper financial incentives. And those are some critical focus areas. So obviously, government payers, we all know one of their favorite phrases is, fraud, waste, and abuse, right? It's to be avoided at all costs. And if you don't avoid it, it is going to cost you a lot of money. So that is a major focus. Doesn't matter the size of your entity. You want to make sure that you are paying attention to fraud, waste, and abuse. I put fraud and abuse on here. I didn't include waste necessarily. Fraud and waste is, just as important. But a lot of times, if you have an effective compliance program, that waste kind of gets figured out through your policies and procedures, right? Usually, waste is more a efficiency thing, a procedural thing where you just need to kind of tighten up some of your practices. Um, Along those same lines with billing, coding, and documentation is doing those baseline audits. So the OIG does recommend that you do baseline periodic claim audits. So we talked about auditing and monitoring a little bit before, it included kind of your whole compliance program. This specifically, I'm talking about your billing and coding. You want to be able to identify errors. You want to be able to identify potential overpayments, obviously, right in line with fraud. Waste and abuse is not returning overpayments to the government. Now, usually they find you and they recoup those overpayments on their own, but sometimes you do find ones that you're like, oh, they didn't figure this one out, or maybe it was a coordination of benefits thing that Medicare doesn't know that that beneficiary might have another insurance, but you do because they told you. So you want to be able to do those baseline audits. So what those can look like is just small claims reviews, right? Maybe 5 to 10 charts per provider, maybe per payer, depending on how many payers you work with. For sure, focus on those federal payers. But you just want to look and say, okay, is everything aligned? Are we meeting medical necessity? Are our providers documenting everything properly? Working in the RCM space, that was one of the trickiest parts was providers not completely documenting things. And it was always so heartbreaking because, having to tell them that, hey, your documentation doesn't meet, this code that you're saying that we should code for you. And they're telling us, hey, but I did all of that. And it's like, great, then make sure you get paid for it. Make sure your documentation is supporting that. We want you to get paid for it. Speaking of RCM companies, a lot of times what I find with practices is they kind of maybe slack a little bit on the billing and coding audit side because they say, oh, we use a third party vendor for that. And so that makes you kind of feel like, oh, I'm going to wash my hands of that audit because, I'm trusting them to do everything correctly. Well, I worked for an RCM company and I trusted our RCM company, but as you as the provider, that's still your claims, right? You are still liable for what gets sent on those claims, what gets billed to those payers. I would 100% be auditing your RCM company. And again, they're not probably doing anything, hopefully illegal. But you want to be able to check up on them. And maybe that is just like kind of a once a year deal of making sure that what as the provider, as the provider's office, what you feel like should have gone out on that claim actually did. But again, that can be part of your baseline audits. If time and resources are obviously an issue, focus on those high risk codes. Focus on E&M codes. Focus on codes that have high denial rates or ones that do see a lot of fraud, waste, and abuse cases, like DME codes, those types of high risk codes that get a lot of denials, that you have a lot of issues with medical necessity. Those are great places to start when you talk about billing and coding. Again, that documentation is king, right? We all know if it's not documented, it didn't happen. So it's good to do those baseline audits. Next up, we have HIPAA privacy and security, and then those breaches, right? So we talked about risk analysis. That is, again, something required by HIPAA. They want you to analyze your systems. They want you to analyze your users and what level of PHI access they have. They want you to analyze all of those safeguards. If you're like, safeguards, what is that? Something you can easily go and Google. Go and Google what are the HIPAA safe security safeguards. They will give you a whole outline of what each of the safeguards are and what the addressable or required elements that HIPAA has identified within those safeguards. But make sure you're doing that risk analysis. As far as controls on the small practice level, sometimes those HIPAA security controls can feel overwhelming, but there are some cheap and free controls that you can put in place today. One of those things is unique logins. Everyone should have their own username and password for anything that accesses PHI. There are not exceptions to that. That is clearly outlined within HIPAA that you should not be sharing logins. Part of that is because if there's a breach, then you need to be able to trace back what login was used to access that information, what person was using that login. If you have 5 people sharing the same login, that's not defensible. If you get investigated, you can't say with confidence who actually was using that login at the time of that incident, and that's a big no-no to OIG, OCR. But that's something that's free, right? It might take a little bit of time to make sure everyone gets their own login, but that is something that you can put in place right away. Another one is automatic log off. So when people step away from their computers, when they walk away from their desk at the end of the day, you can set up automatic log off on your computers, and that's free. It doesn't cost you anything. Again, probably will take you less than 5 minutes for each person to set that up on their workstation. But that is a control that is identified in the HIPAA security rule. That's an easy win for small practices. Next one is encryption. Now, encryption might end up costing you a little bit, but I would say nowadays, with how widespread it is, not only in our industry, in the healthcare industry, but across all industries, it is a lot more economically possible to have encryption. If you are currently emailing any sort of PHI without encryption, I would either say stop doing that and find a different way to communicate that information, or two, work with a vendor who can add encryption to your email. If you think, oh, Gmail has told me that my emails are encrypted because they use, that baseline encryption, great. As soon as it leaves a Gmail server, right? If you email from your Gmail account to an Outlook account, you now lose pieces of that encryption. So there's so many nuances with that, that our suggestion always to providers is and practices, do not email PHI without encryption. Get that in place, especially nowadays. It's not super expensive, so that can be an easy win for your practice as well. As far as breaches go, that incident response, we kind of talked about that, right? That prompt response, thorough investigation, and corrective action. So even just a simple response plan in place, write it down. of, okay, first step is you receive a complaint, you receive a possible incident or breach that an employee has reported. Here's the investigation steps that I need to go through. Just make like a simple template and then a simple template that then has a section that says corrective actions where you write down, here's the corrective actions, whether you provided additional training or whether you changed one of your policies or procedures so that it made it easier for people to follow HIPAA. And then that's something that you can easily just fill out every single time. You can follow up on those corrective actions, have a little place where you can check off, yep, we did this, we did that. And then that just shows that you're having a proper incident response. Exclusion screening. So this is screening on the OIG, SAM, and state Medicaid lists. If you work with federal dollars, if you receive federal dollars, you cannot work with, employ anyone who is on these exclusion lists. This is something that a lot of practices struggle with because it is a time killer. If you have to not only look up all of your staff on these lists, all of your providers, you should be checking all of your vendors, all of your subcontractors. It can become a little bit cumbersome. This is another one that there are vendors out there who just do exclusion screening. It is something at HCP that we offer as part of our product as well. It also can be done manually. Okay, so there is no excuse to not do exclusion screening. You can go on the OIG's website, you can go on SAM's website, and you can go on this individual state Medicaid site and even just Google, OIG exclusion screening, SAM exclusion screening. That website will pop up. You can put in the necessary information to make sure that that person is not on any of those lists. That is something best practice is to check those lists on a monthly basis. But again, this can be a small win for your practice because it doesn't have to cost you any money. It will cost you a little bit of time. But if you're doing it on a regular basis, keep a log of it, then that just helps you to know that you are not working with people who are on that list. If you do, let's say you employ a provider who actually ends up being on one of those lists, you will have to return any money, any revenue that they brought into your practice. So this is an important one to do. Quality patient safety, medical necessity. I'll quickly go over this, but you want to make sure you have clinical risk assessments. The OIG also recognizes outside of just HIPAA compliance that they want to make sure that patients are safe, right? That they are receiving the highest quality of care possible. Sometimes those risks are just really in staff training. There's gaps in training. And maybe you needed to quickly onboard a new staff member because you're in a small practice and you're like, hey, we need the help. And maybe you rush through some of their training. And so that patient isn't getting the greatest quality of care. You want to evaluate those risks. That could be based on the population that you serve, some of the different specialties that you offer. There's some different nuances of that, but you want to make sure you are focused on patient safety and quality of care. Again, that auditing piece, you should always be auditing medical necessity. We all know that that's repairs are going to get you, right? They definitely don't want to pay for things that they do not deem as medically necessary. Those overpayments, especially for government payers, but even commercial payers, if you are overpaid, that money does not belong to you. You have to return it and then make an auditing plan. Make sure you have that formal kind of plan in place. Last poll question here is which of the 4 risk areas that we went over do you feel like is your biggest gap? So billing, coding, and documentation, HIPAA privacy, HIPAA privacy, security, and breach risk, exclusion screening, quality, patient safety, medical necessity, or nope, my compliance program is perfect. We'll just give you a quick few seconds there to answer that. Again, no shame. This is a safe space. All right. Josie, go ahead and show us what we got. Okay, billing, coding, and documentation. Interesting. Okay. Yeah, I'd say that makes sense to me. And then based on kind of previous answers, HIPAA privacy, security, and breach risk, excuse me, makes sense. If you answered my compliance program is perfect, please reach out to me because I would love to know all about your compliance program. I'm not saying it's not true, but I would love to learn more about what things that you have in place. So that's awesome. All right, I'm going to quickly go over the top challenges that most practices, small practices face. so that we can get to the roadmap. So obviously limited budget and staffing, right? That's usually number one. You think, oh my gosh, how can I do a compliance program? We barely have the budget and staff to just do like our regular jobs, even though I would consider compliance as part of everyone's regular job. But that is, somewhat of a mindset shift that not everybody maybe necessarily agrees with me. Competing priorities, right? That can come at you from lots of different spaces. You have day-to-day operations, staffing, revenue pressures, right? Probably sometimes leadership saying like, "Oh, we'll worry about that compliance stuff later." But it really shouldn't be handled later. It should be handled um, as soon as possible. You want to be proactive, basically. You don't want to end up on the other side of a breach, an investigation, an audit, without having starting to put these things in place. Lack of formal assessments, that's a huge challenge. Inadequate or inconsistent training, like we talked about. Maybe you're like, oh, we haven't done any HIPAA privacy and security training in a long time, or we haven't done cybersecurity training. That's a huge challenge. Technology and cybersecurity gaps. So, as a lot of you mentioned, those your concerns over the HIPAA security and cybersecurity, those are some of the biggest gaps that we're seeing with our clients as well. Um, Technology is moving a lot faster than I think all of us were prepared for, especially with AI and all of that. So that's a huge challenge. Weak internal controls, not really knowing who has access to things. Um, you might have legacy systems, you might have really old systems that um, don't function or can't even put some of these safeguards in place. So that is a challenge that a lot of small practices see. And then the last challenge is really no structured reporting and response. So as we talked about, um, you know, you're like, oh, we, dealt with this incident, but it wasn't documented. There was no corrective actions. There was no plan to try to mitigate, the risk that was presented. All right, so let's go through the roadmap real quick. And really, it's a three-phase roadmap. We're going to go from starting with a viable program, operations and monitoring, to a mature program. So that is the goal. I have put timelines on these. Obviously, within your organization, it could be different, right? But phase one, let's say in the first 0 to 3 months, first thing, let's designate a compliance contact. Okay, let's make sure someone is championing that program for you. Adopt those core policies. Again, look for those HIPAA gaps. You might have some. You might think you have all the policies and procedures that you need, but I almost guarantee you're probably missing some. Do a baseline risk assessment, from that beginning piece, go through a security risk analysis. It might be a little rough, right? The first one. But get that baseline of kind of where are we at today? What are our risks today? Phase two would be, all right, we got some policies and procedures in place. We have a compliance contact. We're getting things going. Let's launch training. Let's make sure that we are covering all the training elements that we need to: HIPAA privacy, HIPAA security, cybersecurity, OSHA, patient care, quality of care, whatever you identify, let's get that going. You want to start within this space to do that low volume auditing and monitoring. So start that first baseline audit of claims, start monitoring those policies that you got put into place in phase one and see if they're working. And then you also want to set up that reporting and response process. So again, even just a simple template of here's when we receive a report, here's how we're going to handle the response. And then the third phase is that annual risk assessment. So you did that baseline one to figure out, okay, here's where we're at, here are our risks. I would encourage you to do a second one then, between that 6 and 12 month period, maybe closer to the 12 months if you did a baseline one of, okay, let's see if we made improvements. Let's see where we still have gaps. You want to integrate that quality and patient safety. Again, after you've established those policies and procedures, figure out still where you might have some risk areas that need to be there. And then lastly, in this phase three is document everything. This is what I tell clients is, hey, you're already used to documenting everything in your encounters, right? When you see patients, compliance is no different, just like HR is no different. You want to document everything. You want to show that you have training records. You want to show that you did complete a risk analysis. You want that documentation of your audits. So that is, again, very quickly, but those are the three phases that can help you to kickstart, or maybe you're already in, phase two and you're like, I don't know where to go from here. Maybe here's some helpful things to really move that program from kind of non-existent to existent to hopefully a full functioning, even just simple compliance program that will help you keep in line with those OIG suggestions. All right. So we're pretty much up on time, but I don't know if we had anything in the Q&A. We have about a minute if there was anything in there, Jake.
Nope, nothing in the Q&A that we haven't responded to or answered. So thank you for those that asked questions, and we'll certainly reach out if you've sent us any emails about questions that you've had on the webinar. We'll certainly reach back out.
Yeah, perfect. And yeah, as I said, feel free to reach out to us. We have a website. I'm on LinkedIn, Jake's on LinkedIn, Josie's on LinkedIn. So if any questions came up from this, I know that Josie will be sending out these slides at the end of the presentation. But yes, please feel free to reach out. You're not alone out there. We do understand that compliance can feel scary, but our goal is to help it not feel scary and to help it feel achievable, attainable. So yeah, thank you all so much, and thanks for joining our webinar.